Well, now that school and work are starting to get back to normal, it is time to get back into a healthy routine. Dr. Eric Kusher from Compass Fat Loss is joining me now to talk about getting healthy. And it's really a lot more than just weight loss, although that's something a lot of us want and that you specialize in. So thank you for being with us.
Hi, Kara. It's a pleasure to see you again.
You know, we've had you on Better Connecticut many times, and just give, as viewers are joining this Facebook feed right now, you've said this before, if losing weight was easy, everyone would do it. And so this is a program where you really guide people with daily support that's customized so that they can really lose the pounds and a lot of times get off their medications and feel healthier.
Yeah, you got it. If it was that easy, I'd be out of a job. But you know, the important part really is that it's important to follow weight loss and make sure that the job is getting done, but it's just so much more important that we're losing the right kind of weight and that health risks are continually improving. This can only be accomplished by watching a whole collection of data points that we see every day.
Yeah, and so I want to put the data points on the screen here for everyone to see, and you're monitoring weight, BMI, body fat, muscle mass, hydration, and visceral fat. And we're seeing right now a screen of a graph. Is this something that the person who's losing the weight is going to be interpreting, or it's you who's telling us each day how we're doing?
No, we leave the interpretation to the professionals. We do that. But the patient really does see this stuff every day, so they can follow right along with us. And you know, these measurements that you just mentioned, they're the most critical to inform us as clinicians that the job's getting done in the healthiest way possible. And we're not simply focusing on losing weight. So the way that it breaks down is the weight and the BMI are the two that are going to give us the best overall picture that we're headed in the right direction at the right pace. The percentage of body fat and the percentage of muscle mass, those are ensuring that we're losing primarily fat tissue and retaining the muscle tissue, which is what we want. And then the hydration levels necessary for all the chemical reactions that have to take place that result in the metabolic changes. And finally, the visceral fat that you see is the one that correlates in particular with level of risk for metabolic type diseases. We're talking about diabetes and cardiovascular diseases and hypertension and things like that. So each of these things are values that we watch every single day. So you know from comparisons to other programs that we've done in the past, without mentioning any names, you may be lucky enough to get in once a week or once a month and they'll take your weight and maybe they'll take out a tape measure. We're watching all these clinical data points every single day to make sure that we're not only losing weight, but the patient's getting healthier at the same time.
All right, now people are going to go, how are you going to watch me every day? Do I have to come to your office every day? In fact, that's not the case. You get a special scale, right? And you can see exactly what's going on with us remotely.
Yeah, we love to see patients, but we see them anyway in virtual. So we send them you call it a scale. It's actually a body composition analyzer, and they open it up, and our staff helps them sync it with their cell phone. And all they really have to do at the end of the day is get up in the morning and step on that scale, and all those key values that you mentioned before will get transmitted to their phone so they can track it in real time. At the very same time, in real time, it gets transmitted to my dashboard so I can watch their progress every day. So if they're cruising along and doing well and losing weight on a regular basis, they're going to get quick communications every single day from us. But if they happen to hit one of those little sticking points or plateaus where they don't lose for a couple of days, the system is going to flag us. So we're going to pitch in real time and we're going to figure out what's going on. We're going to help fix it, and we're going to make sure that progress stays consistent all the way down the line.
I want to let folks know who are joining the feed right now on Facebook Live that if you do have a question about this program, I'm happy to try and give it to Dr. Kusher at Compass Fat Loss. Well, first of all, Compass Fat Loss, you can reach people in all different communities, especially because of the remote aspect. But where are you located physically for people?
Our operations center is in Glastonbury, so if anybody needs to come by the office for product or anything like that, we're pretty centrally located. But again, we had the fortune of going virtual probably about 2 years ago.
Mm.
So we had 4 brick and mortar offices. We consolidated all the patients into an online platform, which worked out beautifully with very little resistance. And we don't miss a beat. We get everything that we got before. And this was way before COVID ever hit. So it was just kind of serendipitous that when the virus came, we really didn't have to change a thing.
So what's step one? I know that on your program, you can lose up to 40 pounds in the first month, which may sound like, whoa, how do you do that? But tell us about what people are eating, because this isn't a starvation diet, right?
It's not a starvation diet. Maybe more importantly, it's not a diet that requires you to buy packaged foods or bars or shakes or any kind of gimmicky things. There's no medications or hormones or stimulants. So yeah, you're eating real food that you buy at the grocery store, just like you do now. You might just walk down some different aisles and you're going to get a full healthy complement of proteins, vegetables, and fruits in the diet, as long as you choose the right ones, prepare them the right way, follow our lead. You're not starving on the diet. Most patients are not hungry. There's some little fasting routines that we get into if patients hit plateaus and need to break them. But it's a very simple plan to follow, and it's not very high maintenance for patients.
Yeah, and as we were seeing before with the graphics, you have a way of tracking people, and you're really looking at what types of fat you're losing. Talk about visceral fat and why it's so important that we target that.
Yeah, it's huge. We measure total body fat loss because that gives us an indication of comparing that to muscle mass to make sure we're on track. But visceral fat in particular, as healthcare providers, is what's important to us. Visceral fat, just by definition, is the fat that is underneath your abdominal wall that surrounds your internal organs. And it's a different composition of fat, so it can get measured differently than cosmetic fat. And if it's elevated, it predisposes the patient to an increased risk for diabetes and heart disease and lipid problems and hypertension and things that respond really well on the program. So, my focus is really to get all those health risk markers to come down and get in the right place. And like I've said before, the weight loss is almost a side effect of all that. My goal is to get patients as healthy as they can be, and they turn out to be at their goal weight when they're there.
Yeah. And this is, again, it's not just about losing weight, although I know we all want to fit into the clothes that we want to fit into. But this is, you've seen patients reverse if they're pre-diabetic, perhaps they will not need to go on medication, and you can really course correct cardiovascular issues and diabetes issues.
Yeah, if we catch them in time, we can avoid the full-blown diseases. But we all day long, we have patients that come in that are already on insulin and already on blood pressure medication, and with the work of coordinating with their physicians, we get their dosages cut back and very often eliminated just by following the program. So that's a huge advantage for patients that are either on insulin or taking some sort of medications that they don't want to take anymore. And your lifestyle completely changes when you're out of that realm.
And it's nice to know that when you're working with a program that's been tested and proven, when you're trying to say, oh, I'm not going to eat that cookie right now, that you're seeing the results. And I'm sure that people stay motivated from that. We have someone on the feed right now saying that they have used your program and it works. They've lost over 114 pounds since last August, so just over a year. Congratulations, Lori. And also another question, does health insurance help, or is there a discount for seniors? I know you do have ways of making this affordable for people.
Well, we do. We don't accept health insurance at this point, but we do have really convenient payment plans for patients. So it's hard to find a patient or a prospective patient that can't do the program because of finances, because my goal really is to get the work done and the results to happen. The finances come by themselves. So we take care of them and we try to be as flexible with patients as we possibly can.
Yeah. And people are asking, what's step one? So if you're interested in this and you want to check out Compass Fat Loss, which is going to be assisted by you and your team, you're going to get that personal attention, DNA testing, a diet made for you. What's the first step? How do people sign up?
Well, it's super simple. We do offer a free consultation for anybody that's interested in learning more about the program. This is about a 25 or 30-minute consultation with me. And patients should know that I'm in the process the whole way. So they're going to meet with me. It's not like you see the doctor once and then you're off, seeing some staff member the rest of the time. We interact throughout the whole process. So if somebody wants to schedule the free consultation, and it is 100% free, we want to educate you about the program before you make any kind of commitment. They can just go on the website, compassfatloss.com, and they can click for a free consultation, or they can call us at 800-735-2281, and one of our staff will take care of that. Once they schedule for the consultation, they're going to get a video in advance. This is about 25 minutes long, which explains all the nuts and bolts of the program to them. So when it's time to make a yes or no decision, they're fully educated. They're not guessing at anything anymore. And then if there's any questions remaining, that's what we'll take them through when we do the actual consultation.
And for those who are just listening, hydration, you say, is so important. So I know sometimes we just we forget to drink water. And I think wearing the masks, it's even harder now to make sure you're drinking enough water. Why is it so important to drink water to lose weight?
Well, it's super important for a couple of reasons. Number one, all these reactions that are taking place to get the metabolism to transition over are taking place inside your cells. So if you drink a lot of water and you're not taking the proper supplements and salt and different things with the water, it's going to increase your blood volume, but it's not going to get into your cells where the metabolic work actually has to be done. So we need to make sure that patients' intracellular hydration is what comes up, and that's the one that we watch. It's also really important because as you're burning fat at an accelerated rate, especially during the first part of this process, most of the toxins that you carry in your body right now are encased in fat tissue. When that fat burns off, the toxins get released into your system, and you need a higher level of hydration to wash that out and flush out those toxins through your kidneys. So the water is important, and there are some supplements at the beginning that are important to help mitigate that process.
All right, and again, you're going to be guiding people through that. And if you do make your goal weight, which many of your patients do, then it's not over because you help people stay that way for the long term.
Absolutely. This is super important to me. If I were here just to get people to lose their weight and watch them creep back up again, I would be virtually useless. So it is super important that we get the weight to come off in the first place, but it's always been way more important to me that once we get them there, we keep them there. So when patients get to goal weight, the technology system allows us to set a very tight range for them. So if a patient wants to get to, say, 150 pounds, just for example, and they get there, we'll set a range of 147 to 153, and we'll continue to watch them every day. So if they creep out of that range, we get an alert, we're notified, we reach out, we figure out what's going on, we take them back down, and we maintain that weight within a very narrow range for life.
All right. So you're going to keep people on track. And again, you got your phone, and a lot of people are learning how to do things virtually, but you can track it, we can track it, and it's all done through this technology. So again, it's Compass Fat Loss, and people can go to your website and give everyone a shout out again of your website and the phone number in case they're interested and want to get that free consultation.
Sure, it's compassfatloss.com. Couldn't be easier. The number's 800-735-2281. Just let us know you want a free consultation. We will make it happen.
All right, Dr. Eric Kusher with Compass Fat Loss. Thank you so much for being with us.
Always my pleasure. Have a great day.
You too.